thank you to everyone who is joining tonight. We appreciate having you. Feel free to send any questions in the Q&A and also in the chat function, and we'll try and answer them live as well. We've also seen the questions that were submitted on the registration, and we'll get to those in the second half of the webinar. My name's Anusha. I'm the National Co-Chair for GSSA. And Liza, if you want to introduce yourself.
Sure, I'm Liza Hill. I'm a second-year student at the University of Arkansas for medical sciences. I'm an MD and PhD student, and I'm the president of our chapter here.
And tonight we have two awesome integrated vascular surgery residents with us. So I'm going to do brief introductions and then hand it back over to them to talk a little bit more about their surgery careers and how they got involved in vascular surgery and also global surgery. So first we have Dr. Elizabeth Miranda, who goes by Lisa. And Lisa is an integrated vascular surgery resident at the University of Southern California and is also a Paul Farmer Global Surgery Research Fellow at the Harvard Program in Global Surgery and Social Change. Her work has included health systems research, policy support, and supported research capacity buildings with particular focus in Rwanda and the Southern African Development Community. We also have Dr. Alaska Pendleton with us. Alaska is a fifth-year resident within the MGH Integrated Vascular Surgery Residency Program, and she's currently completing her second research year as a fellow, also within the Harvard Program for Global Surgery and Social Change. Originally from Wisconsin, Alaska earned her BS in Biochemistry and German from the University of Wisconsin-Madison and her medical degree from Harvard University, and is currently earning her MPH from the Harvard T-Chan School of Public Health. So thank you both for being here with us, and I will kick it over to Lisa to start off with a little bit more of an introduction into her.
Yeah, thank you, Anusha and Liza, everyone, for having us. I always get really excited to talk to people about vascular surgery because I feel like it does not get the attention that it deserves because it's still growing. So hopefully you guys can start spreading the word to the rest of your classes. But yeah, so basically, like you said, I'm currently a vascular surgery resident at the University of Southern California. I also went to medical school there at Keck, but my global health interests kind of went all the way back to college. I was involved in a couple of different global health experiences there, the first one being just one that I kind of decided to go on myself. The summer after my freshman year of college, I went to Nepal for 3 months just to, you know how it is in college, you want to do something new, get a cool experience. So I ended up going there just to shadow a doctor at a hospital in Nepal. And that kind of opened my eyes to global health and, the big impact that you can have addressing health issues and social issues, systemic issues on that level. So I kind of kept pursuing that, didn't really know I wanted to do surgery until my senior year of college when there's a course that they offered in my undergrad college called vertebrate surgery, where you work with veterinarians at the Harvard Med School to learn like basic surgical techniques using the pigs they have in their lab. And that at that point I was like, okay, surgery seems pretty cool. And that kind of confirmed it when I did my rotation as a third-year med student. In medical school, I was involved with Healing Hearts Across Borders, which is a organization that goes a couple times a year to Tijuana, Mexico, and they've been running some clinics there for the past over 10 years. And during my time volunteering there, I kind of saw the need that there was for surgery, and actually saw for the first time diabetic foot wounds, and that, the whole problem of trying to manage those without having adequate access to surgical care. And that was the first time it really married those two interests of mine, the surgery and global health. Vascular, so I initially was interested in cardiac surgery actually. And so looking through my rotations, I was like, which one of these sub-Is could actually inform cardiac surgery? So I chose vascular and decided I liked it a lot better than my cardiac sub-I. So ended up making a switch at the last minute to do vascular. So I think we go into a little bit, we'll probably go into it later about specifically why vascular, but I've been really happy with my choice so far, my three long years. And I think it fits really well with the global surgery interests as well, which we'll get into. So I'll stop talking now and then let Alaska go.
Hi, so I'm Alaska. I had in some ways a similar path to Lisa in that I first kind of found global health work. And so I knew I wanted to do surgery kind of starting from even in high school. I thought I was going to go into surgery. And I similarly thought I was going to go into cardiac surgery. My sister had a heart issue when she was young, and I thought that I would be able to, operate on her heart, even though that obviously has major ethical issues associated with it. And luckily she had a procedure done and was fine, but I kind of, from that point, thought I'd be going into cardiac surgery. It turns out that I found cardiac surgery pretty boring. When I did a cardiac rotation and realized that vascular was much more in line with what I was interested in. But that wasn't until medical school. In college, similar to Lisa, I kind of realized that I wanted to do health work that was on more of a global scale. And I majored in biochemistry and German, which didn't allow for a lot of kind of opportunities in low resource settings. And so I ended up joining Engineers Without Borders, and I worked in Kenya on some water and sanitation projects. I was the only non-engineer in the group, which was an experience in and of itself, but it kind of got me to the context that I wanted to be working in. And that continued in medical school, where I had the opportunity to work in South Africa on some HIV and linkage to care projects, and then later back then in Kenya, Senegal, and a couple other countries on a pelvic organ study, including looking at kind of postpartum hemorrhage and ways to address that. And so basically, I tried to find ways kind of throughout my education, medical and otherwise, of being involved in projects that I thought would kind of increase my ability to deliver healthcare later on in a surgical context. When I entered medical school, it kind of became clear to me that surgery is still very much a developing field in terms of kind of global health initiatives and global health work. And particularly what I thought was going to be going through cardiac surgery, there was very little being done in kind of a global health context. When I realized that I wanted to do vascular surgery, and I'm happy to talk more about that later, but when I realized I wanted to do vascular surgery, that field was at that time kind of incompatible with global health work as it was at that time defined. And that there really were not a lot of people, at least in the United States, who were thinking about vascular surgery on a global perspective, in a global context, or in kind of low resource settings. But, Lisa and I are both here today, so obviously we found a way of kind of melding those two passions of ours. And I'm happy to talk about that more later in the webinar.
Well, thanks both for sharing. I always think sometimes that the heart gets a lot of the platform, and then you forget that you have this whole vascular system, or maybe you don't even learn about it in like high school and whenever you're learning about anatomy, and that it really does so much for you and carries blood everywhere, which seems like a simple concept, but it's really important. And also for those of you who might be listening, we do have another webinar on cardiac surgery and on CT surgery. So if you end up swinging the other way, definitely check out that video.
Okay, I think we're going to start with some questions that are kind of pre-written. So the first question we have is, can you give an overview of how research time looks in your subspecialty and the most common ways that people use your research time? How have you seen residents incorporate global surgery work into their residency schedule, long-term or short-term, or in programs, master's, fellowships? Just kind of give us some insight on that.
Lisa, do you want to take the question first?
Yeah, sure, I can start. So generally within vascular, if you're looking at the integrated programs, it kind of ranges from program to program. Some don't have any research time dedicated. I think most of them, I would say, have at least 1 year, at least the more academic ones. And then some are very heavy academic and actually do 2 years of research. But you can kind of decide based on how interested you are in doing that research during your residency. In my case, actually, USC is 1 year dedicated, but I asked them to give me a second year so that I could come to PGSSC and do the fellowship. And they were happy to. And that's actually something that I brought up during my interview to let them know that that might be something I'd want to do and see how they'd react. And they were pretty on board with it from the beginning. So that's something I'd recommend doing even if you're looking at programs that might only provide 1 year. You can kind of float the idea, see if they would be okay with you taking another year. and how flexible they are with that. So in terms of incorporating global surgery work, I don't know if Alaska, if you've seen more, but honestly, Alaska is the only other global surgery like resident within integrated vascular who's taking time to do global surgery focused research. It's still pretty new. I know of other like medical students who are applying into vascular and other like younger PGYs who might be interested in doing global surgery work. But as of right now, it's not very common. Hopefully, so like in my case, for example, I did an MPH also. When I did it, global surgery was still growing. So I personally hadn't encountered it yet, but I know a lot of people who are taking time, like if you're doing a master's before going into residency, to use their research and like their thesis projects to focus on global surgery work. So it's hard to say what's happening long-term because it's still developing right now, which is, it's new and kind of exciting. So it's kind of an opportunity to develop that for people coming up, but and kind of make it what you want it to be.
Yeah.
Alaska, sorry, your mic went out, although you're unmuted. Alaska. Sorry, your mic went out, Alaska. Oh, I don't think she hears me.
I don't think she can hear us. I'll message her.
Did my sound go off here?
Yes.
Okay.
Here. So I completely agree with Lisa that you can ask for what you want. And so there were programs that said, you know, we don't have a research year right now, but if you are interested in coming to our program, we are more than happy to have you kind of have like the beginning of our research program. I think that I completely agree with Lisa that it's very much a new thing. Sorry, they're moving outside right now, which is like the chainsaw noises outside of my apartment. But it is very much a new thing having vascular surgery integrated with global health work. And so there was no one else in my program to date who's been doing global health work and kind of the vascular integrated pathway. Typically, their type of research that they do over their 2-year period. So I'm at Master's General Hospital, and we typically have 2 years. But most people will do kind of basic science research or clinical outcomes research in terms of vascular surgery, and not really expanding out from that at all.
Got it. Thank you. And so I guess just also to backtrack a little bit, what did you find most important when you were looking at these residency programs, and how strongly did you consider support for global surgery when you were choosing a program? I know I've heard different advice on how residency is a place where you're supposed to become a strong clinician, and in this case, a strong surgeon. But also, as I've been watching these webinars with residents who are very interested in global surgery, they've also said that it's important for them, especially in terms of burnout and like their academic passion, to also make sure there's a space for them to engage in the work that's important. So Alaska, do we want to start with you this time?
So one of the reasons why I chose MGH was that they had those 2 dedicated years of research, and that was something that was really important to me. Because during your clinical years, you really don't have a lot of time to be productive in terms of research. It's less important to some extent if you're going into the integrated vascular pathway, because you're not applying to fellowship afterward. So for the general surgery residents, it's much more important that they are more productive in terms of publications, because they are applying to a fellowship afterward. Not that you don't want to have publications at the end of your residency, but it's a little bit less significant for us. But I wanted to have that dedicated research time kind of to break up my residency years and to be able to focus on global health work, because I knew there wasn't going to be much time for that during the actual clinical years, because you're obviously really busy. So I think that, I forget the beginning part of your question. Sorry, it was a little,
what did you find important? Yeah.
So besides I wanted to have 2 years. I also wanted a program that had the potential to do an MPH in it. And so I was really explicit with my program director that that was something that I was interested in, and that was really possible at Massachusetts General Hospital. And then I think the last piece of something that I really looked for in a vascular department, besides like the things that you normally think about looking for in a vascular department, like, you know, their ratio of open to endovascular cases, the number of attendings that they have, their caseload, basic things like that. Something that I also looked really closely at was their general surgery department. Because for the integrated vascular program, you spend a lot of time with the general surgery residents. You spend a lot of time on the general surgery rotations. And even though vascular is not kind of an integrated with global health field yet, global surgery and general surgery are to some extent integrated. And so, for example, at MGH, there are general surgery residents who've been involved in global health work in a variety of contexts. And so I looked for a program that had kind of that historical context of global health involvement, and that really cared about it. So Dr. Susie Briggs works at Massachusetts General Hospital, and she's like an all-star in the field of global health work. And so even though she's a general surgeon, I knew that MGH kind of valued that, that career pathway. And that's actually where I've received like the most support in terms of like financial and otherwise, was from the general surgery department in terms of this work, which was really nice.
That makes a lot of sense.
Yeah, I totally echo what Alaska said about looking at the general surgery department too, because that's, I mean, a lot of your initial years of training, right? Just looking at it as from a clinical perspective too, you're going to be working pretty closely with them. And at USC, like there's some of my closest friends are in the general surgery department because we've worked so well together and like so much together on different rotations. And then, yeah, from a global surgery standpoint too, that's where most likely you're going to get the most support. Like when I was trying to make it happen, you know, for me to be able to do the fellowship, I had to speak with like the chair of the Department of Surgery, and like talk to a lot of the heads of the general surgery program, because budgetary, like from a budget standpoint too, like they're involved in the overall surgery budget and they're a large part of it. So to make it possible to fund you and fund this research, sometimes you'll need to work with them. So really important to look at both the vascular departments and the general surgery department. In addition, yeah, like what you're saying, the usual things you need to look for, like what the caseload looks like, and like what the teaching, you know, dedicated teaching time or education time is something too that is, it's not the same. It's very different across different programs. So if you're looking for more like didactics and things like that, you need to really look for it and ask about it. Regarding global surgery, so I didn't really ask about specifically like global surgery research or like interest, but I made it clear that that was something that I was interested in. And you could kind of tell during the interviews which programs responded well to that and which ones didn't. It's like I had a few people during my interviews say like, why are you applying vascular surgery then? Like, you should be applying general surgery if you're interested in global health work. So I think it's good to get that out there and like make it clear that you're interested in it, so you can see which, and like obviously those programs just aren't a match for what I was looking for. So that's something I would think about when you're interviewing and applying.
Yeah, I completely agree on that point. Like I got a lot of pushback from my vascular surgery interviewers when I said that I was interested in global health work. And I guess my advice to you all who are applying in vascular surgery is be prepared for that question and have your answer. Because it's fine, they don't really care what you answer as long as you kind of have a confident and concrete answer about how you're going to integrate vascular surgery and your global health interests. They're gonna push you on it.
So that flows very nicely into our next question, which is, if you could go back again, what other information would you have ascertained from programs when applying? I'll ask if you want to start with this one.
Something that I didn't think about, because I think that partially I was kind of so anxious about getting into these programs, and sometimes you forget that you are also interviewing these programs, that they're not just interviewing you, which is a good thing to remember. But something that I forgot to kind of ask about is how they fund that research time, which is huge. Some programs have kind of dedicated funding for your research time. They have grants, they have a dedicated salary for you. Sometimes you have to pay back a few of those salary hours in terms of moonlighting. Some programs have support for your MPH, which would be great to know. And those are all kind of things that would push you toward that program. So those are things that it is totally appropriate and acceptable to ask about. And I would, in retrospect, have asked more about that.
Could you add a little bit about like frequency of programs, like percentage of programs perhaps that tend to fund the research year, regardless of what you're doing, or tend to fund an MPH?
I don't know the exact ratio because I did not ask that question during my interviews, but my understanding from kind of my friends who have branched out is that it is fairly rare to have kind of dedicated funding for your research years.
Yeah, just to expand on that too, there are programs too that will fund you, but only if you're working in certain areas. So to just, be really clear about that. So like I mentioned earlier, I had to kind of like make my case for my funding. Normally USC will fund research residents. This was something totally different, and I had to kind of put the case forward to everyone that I could still get the funding. I'm still doing research. It just looks a little bit different from what the residents had done in the past. So yeah, seconding what Alaska said and just being like clear about if there are any conditions, I guess, on that research funding, or if you have to work in specific areas in order to get it.
That makes a lot of sense. Our next question, I think we've already kind of touched upon, but just want to make sure that we round out a little bit. Is there anything else that we haven't spoken about already that you think that it's important for medical students applying into residency or residents pursuing global surgery that you think that they should be asking about and thinking about in terms of support from their programs to pursue global surgery, that is?
Yeah.
So far, it sounds like kind of like time and funding are the two big things, and then allowance, because I know vascular surgery programs are small also, like that allowance to be able to take 1 to 2 years off.
Right. I think that like they're kind of, the huge things of time, funding, and the other kind of like big thing that we haven't talked about is mentorship. And I think one of the reasons why Lisa and I haven't talked about that much is because there are not that many people who are involved in global health work and vascular surgery. None at my institution currently. And even on the interview trail, there's maybe 2 people who I came across who had kind of those dual passions. But that doesn't mean that you can't find a mentor in someone else. So, on the interview trail, I was cognizant of people who could potentially serve as a mentor, because not necessarily they're doing international health work, but were they thinking about kind of the global burden of disease in terms of individuals who had limited access to healthcare resources? Were they interested in just healthcare disparities? And that is something that ties very nicely into global health work. And those type of people are often very excited about doing kind of larger projects. And so you can still identify mentors who maybe don't have that kind of international component, but still have that kind of social justice and equity perspective in their research.
Yeah, exactly that. When you're like in looking for mentors, we've talked a little bit about looking at the general surgery programs, but another program to look at might be the emergency programs too. Because I'm a little biased because the ED residency program at LA County is extremely active. And there are actually a lot of people within the ED program who are doing international work. And vascular is a lot of emergencies, so it ties very well actually into a lot of ED trauma research. That kind of stuff actually dovetails really well with vascular. So as of now, that's probably the place where you're most likely going to find mentors who are doing this kind of global surgery, global health work, and then at least gives you that base, and they have that background to be able to guide you moving forward as you translate that into vascular research.
Makes so much sense. And I guess our next question kind of plays into that a little bit as well. So many teaching hospitals have global surgery centers or initiatives that span across all surgical or like anesthesia, SAO specialties. How would you recommend students connect with these centers during their virtual interviews, especially with vascular, which is not always included in those initial kind of centers? Lisa, if you want to start, sorry.
Yes, are you saying with that question for global surgery centers within the same institution as the vascular program? Or?
Yes. Or I guess counterpoint to that, have you like outsourced most of your involvement with like larger global surgery centers?
Yeah, for me, it's a little bit difficult to answer that, just because there aren't that many on the West Coast, right? There's not a lot of global surgery centers right now on the West. There's a few, you know, like UCSF obviously has a lot of work, more in like Northern California. In Southern California, it's still kind of a new thing. And that's one of the conditions where, like I said to my chair, like, please let me do this, is that I'll like try to bring it back and make this a thing here, like, so we can start doing this in Southern California too. So honestly, because I went to medical school in Southern California, that wasn't really on my mind because I hadn't been as exposed to global surgery centers, you know, when I was applying to residency. I definitely think that as you're applying to residency, it's important to think about what you want to do during your research time and to have that kind of plan mapped out, and knowing where these global surgery centers are helps a lot, and knowing like what kind of opportunities they offer. So like for me, I kind of knew that I wanted to do this when I was applying. And so, you know, that's part of the reason why I was asking, is it possible to make 2 years, like take 2 years of research time? So yeah, and in general, I'll say, like, as you're trying to plan that out and you're figuring out which global surgery center you might want to work at, I mean, in my experience, everyone is really open to like emails and very responsive. And so just don't hesitate in general in the global surgery community, I would say, to like reach out and email people and try to make those connections. Because people are really open. It's like such a young field right now. I think everyone's really excited to grow it. So as you're applying to vascular residencies, you know, you can also be reaching out to places you might want to do research at.
Just to add real quickly to what Lisa was saying before Alaska goes, something that actually came up when one of the other webinars around this was that, especially because things are virtual right now, it seems like a lot of the residency programs are actually a lot more receptive to emails from medical students, especially to set up a one-on-one Zoom, right? Because you don't always get that like dinner before your interview where you can like talk to people. And so really encouraging students to like find those folks and shoot them an email and be like, hey, can I set up a 20-30 minute chat with you on the phone? I want to talk to you about these things. I think a lot of people are very cognizant of like how the interview season is going to look this year.
Yeah, that's a really good point, Anusha. I actually spent like over an hour with a student who will be applying to my program, and kind of going through her application, discussing like what the interview process will be looking like, what she should be expecting for the course of the next year, and kind of how we could like best frame her application. And so the residents, because we don't have people who are in our hospitals coming in to kind of interview during their sub-internships, are very receptive to kind of having you send an email and have it set up a Zoom meeting. It's kind of our only interaction with you all now. But off that last question, I completely agree with Lisa that it wasn't real. One of the reasons I chose my current program is because I knew that there were a lot of connections to kind of global health programs, including the program for global surgery and social change. I wasn't as cognizant about which centers kind of had global surgery centers, and I did not reach out to any of them before I interviewed. I don't think that necessarily would have changed kind of the vascular surgery department's impression of me, because they're usually pretty close, and so they're focused on other things than kind of who you reached out to in terms of global health work. You're kind of visualized as an anomaly a little bit in your interests. And so I don't know that it would necessarily help your application at all, but if it's something that you're interested in, then absolutely feel free to reach out to the programs, global health centers. But it's not something that I did prior to my interviews.
Cool. Well, this kind of then actually also goes into our next question pretty well. And I have a feeling I might know the answer to this, but could the two of you perhaps name some initially vascular surgery programs that do have some global health or global surgery involvement? And I guess on the flip side, that where we might have more answers is other programs in general, surgery programs in general across the country that do have strong global surgery mentorship and support, where you think that somebody who is in the vascular surgery track could then, you know, use that to their benefit in their global surgery careers. Lisa, do you want to start?
Yeah, I'm trying to, so like Alaska said, MGH obviously is one that has a very strong support for this kind of work. The University of Wisconsin also, with Dr. Yurma Tefera, I mean, want to say like the only real US based vascular surgeon that I can think of who's doing global surgery.
That was the one name I was going to give as well.
As of right now, he's really the only, although he's like a big one, right? Because he's the director of Operation Giving Back at ACS. So it's a great champion for vascular surgery within global surgery. And I know they have opportunities for their residents to go to Ethiopia and kind of see their twinning program that they've set up with the surgery program there and see how that works firsthand. In terms of so there's a lot of other institutions that, No, go ahead.
There's one other institution I could think of, one other name I could think of who was actually involved in global surgery, and that would be Dr. Alan Durdick from Yale, New Haven. He actually published a book that was looking at kind of vascular surgery on a global scale, but those are the only two names that I could think of in terms of being involved in global surgery and vascular surgery. Sorry, Lisa, to interrupt you.
No, yeah, I mean, it's good to know because I think as of right now, those are the really the only places specific to vascular. Like I said, it's there's a lot of growing support for general surgery, right, within the global surgery program, and vascular, I mean, there's a million ways to tie vascular into that. It's just a matter of bringing that voice to the table. So yeah, I mean, there's a bunch of institutions that have strong global surgery, general surgery support. I'm not sure if they all have integrated vascular programs. So it's just a matter of kind of like matching those lists up to see, you know, like if those universities that have particularly strong global surgery institutions like Utah, Minnesota, VCU, you know, those kinds of places. I'm not sure if they all have integrated vascular programs, but it's something that you could look at also.
Yeah, and the Brigham and Women's Hospital is strong general surgery. They don't have an integrated program, but I'm cognizant that not everyone who is on this webinar may be applying directly to vascular surgery. They may be applying, and a lot of people apply to both general surgery and vascular surgery. And so it's also a good idea to look at kind of general surgery programs that have strong global health programs.
Awesome. Okay, so our next question is going to lead us into the audience-based kind of contributions to this webinar, which is great. We had a bunch of great questions and a couple that came through the chat that we're going to get to as well. But the first question is, what are some challenges that are specific to the field of vascular surgery and global surgery? And more specifically, how do we overcome those unique barriers like cost or access to technology in terms of vascular surgical care in global surgery? I'll ask if you want to start.
Yeah, it's a really good question. And that is essentially the question that you get on your interviews. I think the biggest kind of challenge in thinking about vascular surgery on a global level is that it is a highly resource intensive profession in the United States and in Western Europe. If you think about some of the stent grafts that are used, they cost thousands of dollars. Having like an interventional radiology suite is also costs like hundreds of thousands of dollars. And so it becomes challenging to think about vascular surgery then in low and middle income countries where they may not have access to those type of financial resources. But I think that a really good point is that just because something is not done yet does not mean that it can't be, and does not mean that there is not a need for it. And so we mentioned earlier in the discussion that kind of diabetes, all the risk factors that you associate with vascular disease burden, hypertension, diabetes, smoking, are highly prevalent in low and middle income countries right now. And so vascular disease is also incredibly prevalent. And so thinking about vascular surgery on kind of a larger scale and thinking about how can you do risk factor modification, even just wound care management, those are things that become kind of the challenging drudgery of your job in the United States in taking care of your wound care patients. But wound care is such a necessity in terms of vascular care, and it's so important and not always done correctly. And so thinking about how that can be applied in low and middle income countries is important. Amputations are not simple procedures, even though they seemed in the op notes to be simple, but how to do a nice amputation that is not going to result in someone having an ulcer or be incapable of walking is a huge deal. And then also thinking about trauma. Trauma is one of the biggest killers in low and middle income countries, and vascular trauma is common. And so what type of education can be provided to providers who are operating in those contexts? Because most of the countries that I've worked in, you have one general surgeon who knows vascular procedures as well. But what kind of training curriculums can you have so that they are prepared to handle vascular trauma? So I think that, I don't know the kind of correct transfer of technology and kind of the financial system that would need to be in place to allow fenestrated endovascular aneurysm repairs. But I don't think that that is the immediate jump that needs to be made. I don't know what you have to add, Lisa.
No, I mean, that's all, they totally agree with all of that. I mean, I think what usually happens is when people think of vascular surgery, they think of it, like you said, here in high income settings. And so automatically they think, no, it's too expensive, and then stops there. But, like you were saying, the cool thing about vascular is that it is so broad and it involves so many different areas and fits so nicely with not just other surgical specialties, but with other medical specialties too. So like one thing that I have like associated a lot with global surgery and vascular is dialysis access, because I think that's a lot of like vascular surgeons think of that like mission trips, going to places to create fistulas and then leaving, which is, there's that whole discussion of how not to do things. But then that ties into, why are surgery residents in these countries really not exposed to fistula creation? And a lot of it has to do with access to dialysis machines. What's the point in learning how to create a fistula if these patients don't have the resources to stay on dialysis, for long periods of time? And so that opens a whole other field of like being able to work with, medicine in other, the NCD Alliance and, the Lancet Commission on NCDIs just released their report, talking about all these chronic diseases where vascular can tie in really well to help kind of solve those access issues. So, I mean, it's a challenge in that people don't currently view vascular surgery as something that can be applicable to LMICs, but because it is so broad, it is actually pretty applicable in a lot of different ways. And then the other unique thing about vascular is our relationship with private companies, right, with technology. I mean, we have to work really closely with representatives from Medtronic, Gore, like all these big biotech companies to be able to use grafts and things like that. And they have access to funding that, is a completely separate area. So it's another, like we're talking a lot about innovative financing and things like that. I mean, those are opportunities that could be utilized if we just have those conversations and figure out, what the best way to work together to address these issues in LMICs would be.
Yeah, Lisa, I love that you brought up, issues around dialysis and just like a broader range of disease care, because I feel like even in the US, we have a lot of issues with patients getting dialysis access, maintaining it for a long time, until if they get a kidney transplant to begin with. And also with, I think the breadth of vascular diseases, like sometimes it can feel like management here hasn't been perfected. There's a lot of room for innovation. And, I feel like a low resource setting almost really makes you think like what is important and what do we need for the patient and how do we do that well?
Yeah, Anusha, and something that I brought up multiple times during my interviews is that a lot of times the physicians who you're being interviewed by envision global surgery as you going to sub-Saharan Africa and operating there. And I'm from Wisconsin, and a lot of my family lives in areas where it's greater than 2-hour drive to receive care. So that is a limited resource context in terms of medical care. And so I would often try to draw it back to the fact that, you can also think about global healthcare in terms of the United States as well, where you have huge rural populations and even populations within urban areas that don't have access to care. And there's gross disparities in terms of your access to vascular surgery and vascular care. And so thinking how you can improve healthcare outcomes within those populations also falls under the umbrella of global surgery. And that was a little bit more kind of understandable to some of the people who I was discussing this with.
Yeah, and I'm glad actually that you brought that up. So we had another question asked via the chat, and we kind of answered the second part of that question, which was, are there any other diseases, pathologies prevalent in global health that vascular surgeons can help with? But the first part of that question was really around how most vascular surgeons don't know much about global surgery or don't see it as a priority. And so we've touched upon this a little bit, but if you could expand on like, how can we change this perspective and increase global surgery interest in vascular surgery? If you have any ideas, that is. Lisa?
Yeah, no, I think I could, I think right now is actually a really good time to start having this conversation within vascular, because I think most of us are familiar with Med Bikini, which just recently happened. But for those who aren't, there was a very controversial article published in JVS, like our vascular Bible, essentially like our main journal, which had to do with professionalism on social media, and then brought up a lot of issues of this imbalance and discrimination and these implicit biases that exist because of the lack of diversity on vascular staff and also editorial boards. So because of that, I mean, I'm actually really happy with a lot of the way that a lot of the vascular divisions in various institutions, and then also the way that the journal has been responding by trying to bring on a more diverse editorial staff. Because of that, like all of this is on the forefront of people's minds. I think people are thinking a lot more about, you know, how do we be more inclusive? How do we break out of the way we've been doing things for, in our focus for the past, you know, however many years vascular has been around. So it's actually an interesting time, I think, to start having these conversations about, okay, so we're talking about being more equitable in the US, but that also applies to a global scale. And to start thinking about, you know, how do we start addressing these inequities, not just in the US, but internationally. And if you look at like the international guidelines that have been published, I mean, it's great. They're collaborating with a huge number of institutions, but most of them are HICs, right? They're Italy, you know, everywhere in Europe. I think there was one set of guidelines that was published a couple years ago that did focus more on LMICs, but it's just the one, you know, out of all of the work that's been done in vascular so far. So I think now is actually a really great time to start having that conversation with, you know, leaders in the vascular field.
Yeah, I completely agree with Lisa. And of note, that article was withdrawn, which I know Lisa knows too. But so I think that this contributes to the idea that now is a really good time, kind of given the socio-political context, and bringing this area to the forefront.
I really love that. I never really thought about it that way, but that is so true. I think that, you know, increasing diversity of thought also, I think, increases kind of like empathy towards the rest of the world, because people come from all those places and from those backgrounds and are looking to give back to the communities that helped shape them.
Absolutely. Alaska, going off something that you mentioned about being from Wisconsin and kind of access to care being limited in many rural places. Well, I'm from Arkansas, so imagine. That was one of the like biggest kind of claims to why we began a GSSA chapter at our school at UAMS, because the state of Arkansas is such a microcosm for kind of like the greater global surgery burden that we're seeing, and kind of seeing the differences between lower middle income countries and higher income countries. And I mean, that can just kind of be brought home so closely here. And so we're trying to apply some of these concepts that we were learning through like the Lancet Commission and all of that to like our true like neck of the woods, as well as more broadly in a global context. So we have another question that was asked via chat. It says, do you think that research fellowships prior to starting residency can help a candidate become more competitive when applying for residency? For example, taking 1 to 2 years after medical school in order to get involved with research and publications prior to residency?
That I can start off answering that question. It's a really great question. And I think that when you're applying to residency, you will encounter so many questions along the lines of, do you think that would improve my application if I did X? Do you think, what if I did Y? What if I did Z? And, you know, it could mean research, it could mean a sub-internship, it could mean getting a particular letter of recommendation. And my answer to all of them is do it if it makes you happy, because there's no reason to do something that is not going to kind of make you happy, and it's going to shine in your interviews too. So if you do 2 years of research that you absolutely hate and that you cannot talk about in an interview with any level of passion and joy, it's not going to contribute to your cause. I will say that, so I took a year during medical school to do research, and there are certain programs that do weigh research a little bit more heavily. A lot of those academic programs that give you 2 years of research are academic institutions, and so they will often look at the type of research that you've done before. So it can be helpful. You don't have to be a first author publication, but it can be helpful at least to have, say, you know, I was involved in some research initiative or research project, which you can also do during medical school. It doesn't have to mean that you take a year off to do that. It could just mean getting involved with a vascular surgeon at whatever hospital you're affiliated with and helping to write a book chapter. That's one of the things that I did. Or say, you know, would it be helpful if you have any extra like projects that I can kind of help with more of like the grunt labor on. A lot of residencies kind of have data sets or have research projects that are kind of stagnated a little bit, and they're always looking for medical students or someone who is interested in kind of doing like the tedious aspect of that project, whether it be like phone calls to patients to kind of follow up, things like that. And that is at least something that you can talk about and that you can write on your application if you are planning on applying to a strongly academic program. It does not mean that you have to take 1 to 2 years for a research fellowship. If that's something that you want to do, I wanted to take a year off, and I'm really glad that I did, go for it. But if it's not something that you think will bring you joy, then don't do it.
Yeah, 100% on that. I think the most important thing is like just knowing what you want. So like knowing what kind of career you want to have and where you eventually want to end up, and then figuring out, okay, so if that's, you know, how I want to, you know, that's how the kind of career that I want to pursue, then kind of then stepping back and say, okay, where's like which program is the best fit to be able to do that. And if it's one of those research heavy programs, then yeah, maybe you need, you know, take a couple years off to try to make yourself, you know, involve yourself in research that will make you competitive for that. But yeah, it's, if you are doing it just to get into a certain program or just because, you know, you're trying to strengthen your application, that is not a way to live your life or pursue your medical career. You want to do it because you're passionate about it. And I think most of us who are involved in global surgery are doing it because we're passionate about it and really want to. So if that's something that you are fine with, like taking the extra years to build that base of research and that experience and the skill set in research, then it's absolutely worth it. But just if you're interested in doing mostly community practice, you know, and focusing more on the clinical side of things, you don't necessarily need all that extra time. And like Alaska said, there's tons of opportunities in medical school to get involved with projects that are ongoing in your department. So that's like absolutely a great way to get involved in research too. So you shouldn't feel like you need to take all that extra time.
I really love that. And especially the fact that you both centered around like making sure you enjoy it. I feel like especially when we were talking about burnout and the stress that we face in medical school already, it feels like, you know, why would I spend all this time doing something that I don't like fully and completely care about? So I really appreciate the both of you highlighting that. Just looking at the time, I think we'll follow up with 2 more questions. So I think my last question for you was something you touched upon a little bit earlier that you're both doing, that I think students sometimes think about, is how important do you think that your NPH really contributes to your trajectory as a global surgeon? Do you recommend it for people? Do you not? What was kind of your thought process in applying for it? And, you know, do you think it's necessary?
Sure. I'm biased. I love my MPH. I am so glad that I'm getting it. I felt like when I'm doing it in clinical effectiveness, and I felt like when I kind of started joining classes again, and I understand during medical school, you get so tired of classes and you just want to be clinical. But after 3 years of clinical, classes feel really great. I felt like all of these codes that I had been reading in kind of the research articles that I had been reading about, kind of like the statistical methods for it, were suddenly being cracked for me. And so it was really nice kind of understanding now very concretely what different papers were doing in terms of their statistical methods. My MPH was particularly kind of statistical and methods heavy, which I appreciated. And then I also delved a little bit more into kind of like the epidemiological theory behind current epidemiology, particularly in regards to women health and healthcare disparities, because that's an area that I'm passionate about in terms of my research and my career. And so I felt like that allowed me to kind of have the background that was necessary to advance my career in that area, as well as to publish in that area, because I didn't want to be publishing about race and gender disparities if I didn't kind of have the understanding for the context and the current political climate regarding that. So I am fully on board with having done an MPH. I recognize that it's not kind of financially or time-wise feasible for everyone, and I do not think by any means that it is essential. A lot of people come into medicine with a lot more experience than I have. A lot of people take like years off during medical school or prior to it. I went straight through, and so I was actually really glad that I had a little bit more time to kind of contribute to my own personal education, and I'm really glad that I did an MPH.
Yeah, I'll say so I did my MPH before, so after the year after I graduated college, and then so the year before I started medical school. And I did that because I figured I was gonna start this like medical clinical path, and I really wanted to pursue the public health thing before I got into that and not interrupt my time. But honestly, like looking back on it, I'm happy with my choice, but I feel like it would have been fine anyway. Like I don't think it would have made big difference if I did it during medical school or in residency. I agree, it's definitely not necessary. You can definitely do global surgery without having the MPH. You can also do it later. Like in my program, there were attendings, who were taking the MPH classes. So like you could always do it later when it's more financially feasible. But yeah, I loved it. I mean, I'm really glad that I did it. And so at my program, I did it at Dartmouth, and they had a particular focus on like social determinants of health and just getting introduced to that concept early on before I started medical school. I think just added to my clinical training and my experience in medical school. That's also where actually, because right now at PGSSE, I'm doing the majority of my work with Rwanda. And that's actually during my MPH was the first time I went to Rwanda and actually got to do my practicum with Dr. Benegwaho, because she just happened to be like offering a position at that time when I was at the MPH there. So I mean, it was just like a great, like really lucky opportunity for me to get introduced to Rwanda and the global health world like firsthand, from someone like her who's an amazing mentor and works incredibly hard. So it's like incredibly inspiring to watch her, how she works. So it's I would recommend it, but it's definitely not necessary, and it doesn't have to be like during medical school or anything. You can always come back to it later on.
Great. So I'll close this out with our last question, which I thought both Anusha and I agreed was such a good note to end on. Where do you see the intersection of vascular surgery and global surgery?
Yeah, I can start. So I think we touched on it a little before, but it's just the field is so new, and there's, like, we've said this over and over, I think, throughout the session, but like it's hard because there aren't as many mentors to follow, but that also makes it really exciting because you can kind of take it in the direction that you're excited about. And there is that global surgery like infrastructure now that's building in a lot of universities that you can join and lend that vascular voice to. So, by nature, vascular is so diverse. You could go in a number of different directions. We've talked about amputations, dialysis access, and even all the way back to just like primary care, diabetes, hypertension, smoking. I mean, those are all things that are extremely relevant to vascular surgery. So it makes sense, I think, for vascular surgeons to be involved in all stages of the process, and anything from the clinical training side of things to health systems strengthening and, the public health side of things too. all tie into vascular and global surgery. So I think it's a very exciting time for vascular and global surgery. So yeah, I'm excited to see where all of you guys on the call take it.
Yeah, I completely agree with what Lisa already said. And I think that there's a couple different areas in which global surgery and vascular surgery intersect. The first is that vascular surgery can very easily pair with kind of global surgery and general surgery in terms of trauma and emergency medicine that already have kind of frameworks that a lot of institutions already have frameworks in other countries abroad in terms of kind of trauma and emergency medicine. So that is one of the easier ways in which vascular surgery can kind of be associated with a program that's already up and running. But then I also think about kind of the fact that there is so much push right now for kind of global neurosurgery. And if there's advocacy for neurosurgery in low and middle income countries, there's no reason why vascular surgery can't also be advocated for. The resources are one and the same. And then just as a last point, I think that Lisa also touched on this, is that so much of kind of our current medical system in the United States is based on that kind of the individual and the individual level factors and that end point, all of which have these structural determinants of health that are coming down to that one thing that you were seeing at the end of it all, which is that gangrenous foot. And I think thinking about from a kind of public health context, the larger picture of what is framing that, what is causing that individual to be in that place at that time with that disability is really big. And even though it might not be an intervention with a scalpel, I think that thinking about the kind of the interventions that can be working kind of more upstream of that, more preventively, is also within the hemisphere of vascular surgery. And so that is an area that I kind of hope to be involved in future years, and that I challenge the people on this call to also be involved in thinking about how do we even prevent that from happening in the first place. But thank you all for your time and consideration.
Oh, thank you both for joining us tonight. I know I learned a lot. I mean, you both know I'm probably applying to general surgery, but who knows where I'll go after that. And I feel like I learned so much about how there's so much capacity for innovation within this field right now, and has definitely piqued my interest in, maybe a vascular surgery fellowship one day. So thank you both so much for being here. Liza, any last thoughts?
I just wanted to say same thing. I am just an M2, so I have a long road ahead of me. But it was really fun to kind of hear your path into vascular surgery, because I too am very interested in cardiac, but also vascular surgery. So that was a nice connection to be made. But also I just think that kind of your insight and everything that you've shared today is something that I am definitely aligned with and am very interested in learning more about and being involved with myself. And so I hope that other people listening to this and the future people who will listen to this when it's posted on the YouTube channel will feel likewise inspired. And I just really appreciate your dedication to this field and taking time to come and talk to all of us today on Zoom.
Cool. All right. Well, thank you both so much. And to all the attendees that were here tonight, thank you so much for joining us. And to everyone who will be watching this video in the years to come, I hope that it sheds some light in the application process. And hopefully, you realize that there's a lot of people also going through the CT versus vascular surgery struggle. And everyone will find their own path. So thank you so much, everyone. Have a good night.
Bye. Thank you.